I just want to take you through what a joined up online to offline veterinary care experience can look like with a push notification sent by a veterinary clinic to a pet owner via PetsApp. So what we'll see here is a pet owner at home with their family, and they're with their dog, and they get a push notification from their clinic. Maybe this clinic has a dental month on, and they send a push notification to all dogs over the age of 2 saying, send us a picture of Daisy Smile. Did you know that 80% of adult dogs suffer from dental disease? So the owner touches that, it opens up the app, throws them into a chat. They can now take a photo of their dog, take a video, or choose one that they just so happen to have taken earlier. And when they do this, their clinic gets notified. Now, importantly, the idea here is not that we're going to be able to consistently diagnose dental disease off a picture that the owner happens to have taken and happens to send us. It's rather trying to trigger an engagement opportunity with the owner to advocate for their animal, an opportunity that we might not otherwise have had. So here the veterinary team gets a notification that a pet owner has replied. They can tap on that notification, open up the app, and they can review that chat, have a look, see if they're comfortable replying to this. If not, they can hand it off to someone else. But this happens to be a nurse, and they are happy to respond. So they jump in the chat, they check the medical records for this pet, and they see that Daisy has never had a dental checkup before. And in accordance with their practice protocols, they feel happy to recommend one. And that's up to you whether you would feel comfortable doing that. But for the purposes of this demo, we're just going to walk you through that experience. So they recommend a time for the owner to come in on Friday for the dental check, and they can even tell them not to feed Daisy any breakfast that morning. The owner then drops Daisy off at the clinic. So this is the sort of online moving to offline, the online to offline experience. And then the owner goes home and sort of gets on with the rest of the day, which just so happens to be baking some cookies, because why not? And during the day, they get a notification from their veterinary clinic letting them know that Daisy's pre-anaesthetic blood results were all fine. How often do we recommend blood results? They come back normal, and then the owner never hears about them again. Now, that's fine in a sense, but next time you recommend pre-anaesthetic blood screening or any kind of sort of preventive medicine screening, the compliance of that owner is likely to go down. Just sending them a photo or a PDF of the blood results and they see a bit of science on the paper communicates so much value. The nurse then communicates that they'll be doing a video discharge consultation at 3 p.m. today. So they've been able to take that discharge consultation that competes with paid for consults in the evening. They've been able to take that and move it to earlier in the day at a time that suits them. And of course, that's completely uncontroversial because the pet is in the clinic with them, and this call is entirely to inform the owner. That means that there can just be a handoff that happens rather than a full discharge consultation in the evening when it comes to pickup. The owner's happy with all of that. And now we're back in the clinic, and the nurse has done their bit, so they hand off the chat to a vet. The procedure gets done. You can critique the dental technique here. And then the vet jumps on the dashboard, the browser version of PetsApp, and initiates the video consult. This looks a bit different today. We've changed the user interface here, but you get the idea. The owner is at home doing it on her phone. And after the consult has ended, they're asked for their feedback. So we take feedback at the end of every consult. And really, there you have it. That's an online to offline experience. Additional things they could have done here. They could have taken payment for the in-clinic procedure before the owner came to pick up Daisy. They could have shared an invoice, PDF invoice. They could have taken consent via the app. But hopefully that gives you some ideas about how you could use the PetsApp campaigns module.